better identification and tracking of medicinal product data, it should help with some of these problems that these countries are facing.
Fantastic. Anything else? Anything else you had to highlight from that group?
I think that would be it for now.
Okay, thank you so much for the summary. Maybe Maria had some additional comments. Maria?
No, I think like Shahan summarized very clearly what were the main points that we were discussing there.
Fantastic, fantastic. And Laurie, how about you? Like to voice yes, what were the main
we had some great conversations with both groups, really interactive. Just a few highlights. One is, well, first of all, that AI in healthcare is the way to go for the future, but there's a few things to think about. One is right now, a lot of the healthcare data, as we know, is operating in silos. And we have to really think about how to do that integration in order for it to be really beneficial for everyone. We also have to think about ethics is really an important aspect of this. And then the other one is that AI is not a substitute for physicians or for the people that are really interacting with people. It's not, it shouldn't be, one thing someone said was, the algorithm isn't, making the decision for me as my health as the patient, but it's sort of like an interaction between the doctor, the patient, and the AI system, so that there's this partnership together, and the AI is actually an enabler. We see it as an enabler rather than it's like a substitution. So there was, and then another one that came out is how to reach remote areas, remote communities, and things like that. So I think there was a lot of other great ideas, and I don't know if anyone else wants to highlight something that we said.
Fantastic, fantastic. Thank you so much. For the moment, I think we do not have that much time to share on large group, Laurie, and please, by all means, if you think there are still ideas that need to be captured from this conversation, you are kindly invited to use the map that I'm going to put here in the chat, so you can comment on the ideas that were already previously gathered. Here in the chat, please, you can join the conclusions map of the ideas. If there are some burning issues you want to comment on the ideas. On my side, my group conversations were very interesting. First of all, there's the importance of the legal framework. So governments need to establish a legal framework that then would create the interoperability possible. And the second important element is that it's not just patient data protection we need, it's life data protection. Because right now, social media companies can have more information about our lives that are relevant for our healthcare, and we are not aware that we are sharing this consent for this information to be used, and if it is misused, it can obviously be a problem. But this is, I think, a summary from the moderators. Thank you all moderators. Thank you all the participants. And now guest speakers, please, final words from you. No, I'm not sure if Professor Lars is in the room, but Gerard maybe, or Sergio Pillon, the floor is yours for final concluding.
Thank you. Well, it's not easy to have a final. Interesting, yes, this is a final comment. It's interesting and it's like a Darwinistic place. We are from all over the world, but it's so easy to talk the same language, to share ideas. And this is a great signal, I think, is a great lesson from this kind of meeting. I am in Italy, you are in Canada, in Portugal, but basically, or in India, but basically, same lesson, same feelings, same future also. And this is a very important lesson. 2 days ago, I think 2 days or 3 days, the EU for Health plan was approved by the European government. And it is very interesting also if you have a look at U4 number health program. There are a lot of things we were discussing here, because the future obviously is not for the technology, is for the healthcare. And the future of health is that the health will be tailored as a dress. We call personalized medicine. Is the medicine not of the patient, is the medicine of the person, is the medicine that act before you have to go to the hospital, is the medicine in the United States and Stanford they call high tech, high touch. And this is the future of digital health. High tech, high touch, and not technology instead of doctors. Technology with doctors, AI, app, digital therapeutics, next future. So very, very interesting to have the same feeling and the same problem all together. Thank you.
Thank you so much. And maybe Gerard, maybe you would like to take the position of Professor Lars. I think he has to have to leave for the moment.
Yeah, he did. Well, look, from our perspective, is always to use technology to focus on the problems and not the symptoms, right? We have a lot of problems and we need to solve them one by one, rather than focusing on the smaller symptoms. The symptoms are, there are many, but I think we can solve more things with less by using technology and using it in a smart way. And I do believe that the tools that we have at our disposal, if we use them right in a unified front, we can really accomplish a great deal. And I really, as a hope, as a personal wish, I wish the EU will really work together in a more cohesive way on healthcare to really tackle the conundrum that we are faced, that we're truly spending 98-99% of our budget to treat the sick, and that's, as I said before many times, that's just not sustainable. We need to treat the healthy in a predictive and preemptive way so that we don't get sick.
Fantastic. It's so good to see such a strong alignment on a new message, a new doctrine for the healthcare provision. Thank you so much, dear participants. And before we go, let me just share here the video with the moments of the Global Health Data Summit. It's a video that collapses the Global Health Hybrid Summit that unfortunately Dr. Sergio Pillon was not there. But the invitation is for attending the eHealth Summit that Bruno Triguis already shared here with us before. And let me just finalize this by sharing here this very interesting video of our Global Hybrid Summit. And the new message is the same here. Okay, so thank you all for your time here with us, and last a round of applause for your participation. Thank you very much. Thank you.
Thank you.
Thank you. Obrigado. Grazie mille. Ciao, Sergio.
Thank you.
Thank you.
Thank you.
Thank you, Paul. Obrigado, obrigado, muito obrigado.
Thank you.
Thank you. Thank you.
Bye, everyone.
Augusto, thank you for coming.
Thank you, everyone.
Thank you so much, Laurie.
Oh, thank you, Paul.
You were featured now in
that was
this.
fun.
Yeah, thank you. Thank you so much. Let me stop the